all of you to raise awareness of this year's theme for World Health Day, Universal Health, Everyone, Everywhere. This theme underscores the need for every woman, every man, and every child to receive the full range of quality healthcare services which promote wellness and treat conditions that affect them. Furthermore, this theme strongly points to the value of having a sound primary healthcare system as the foundational approach for promoting well-being among the population, and one that is rooted in the needs of individuals, families, and communities, meeting them in their everyday existence, where they live, work, learn, and play. We in Barbados are doing our very best in this regard, and so we have made a determination that we are going to not only look at it from a health perspective, but make wellness the cornerstone of our health policy. And that we will be taking wellness as well into every corner of this country to touch every community, every household, every individual. Recognizing, of course, that if we are to do something more significant in terms of combating the scourge of NCDs and the socio-economic impact on this country, that we cannot sit back and wait for persons to come to us, but we have to take wellness to the people of Barbados. The theme, Universal Health, Everyone, Everywhere, is also consistent with the policy goals of the government of Barbados. Goals which place a high priority on providing universal access to high-quality health care for the people of Barbados. As a government, we are committed to achieving a number of new initiatives which we believe will transform the healthcare landscape of Barbados. We are working assiduously to put the necessary infrastructure and processes in place to implement the 24-hour system at the Winston Scott Polyclinic and the David Thompson Healthcare and Social Services Complex by June 1, 2019. This new service will cater to patients who require primary and urgent care services such as acute asthma management, treatment for minor wounds, simple fractures and cuts, as well as abdominal pain and other such complaints. We believe that once operational, this new service will go a long way to helping to relieve some of the stress on the accident and emergency department of the Queen Elizabeth Hospital. In addition, our 9 polyclinics will become wellness centers for the catchment areas that they represent. Recognizing the importance of well-trained healthcare workers to the functioning of the health sector, earlier this week, the Ministry of Health and Wellness and PAHO convened consultations on the development of a human resources for health policy and action plan for Barbados. Discussions were held with senior staff in the ministry as well as partners from the public and private sectors and from civil society. By taking this proactive approach, it is envisioned that this policy, once finalized, will inform decision-making to strengthen the human resources workforce in the coming years. Already, discussions are ongoing with the Ross University School of Medicine for the establishment of a School of Nursing here in Barbados with the aim of expanding the availability of trained nurses for Barbados, the Caribbean region, and even for the world. The focus on universal health also presents an opportunity for us to continue our discussions on policy options for healthcare financing. And I can say at this stage that in the coming weeks, a healthcare financing commission will be established with a commissioner given a mandate to deliver on healthcare financing within the next 18 months. And this is urgently needed to underpin the provision of universal health coverage. Some of the major issues which need to be examined include a fair means of raising funds and an agreed guaranteed package of services that people can access when needed. In addition, mechanisms such as pooling of funds and the management and strategic purchasing to incentivize appropriate quality and quantities of healthcare will also be critical to our decision making.